As the Senate's so-called Gang of Six prepare for a conference call of their own tonight at 9 o'clock, the Wall Street Journal has the following headline. The White House and Democrats are considering a strategy to break the health care reform bill into two parts and pass the most expensive provisions solely with Democratic votes that could speed up the vote and get a measure passed by the end of this year. But because of special interests, because of all the way our government is set up, is there anything in the health care reform bill at this point that actually provides a mandate so there's health insurance for everybody and controls costs, which is why we started this conversation in the first place? There are some out there like our next guest who says you may get health reform, but it won't reduce costs, nor will it provide coverage, which will make you wonder what we're doing. Matt Taibbi with another brilliant piece in Rolling Stone. I recommend it to you. There's the cover of the magazine. In a second, you'll see the cover of the article itself. Sick and wrong. You argue that this is not only a health care issue, but this is a direct referendum on our government's ability to function.
Right.
Why?
Yeah. I mean, I covered the presidential campaign all last year, and health care was the #1 issue on the minds of Democratic voters. I mean, voters specifically elected this president to deal with this problem. And the same people elected a gigantic Democratic majority in the House, 60 votes in the Senate. If they were ever going to do this, this was the time to do it. And if they end up coming up small on this issue now, when they have the first chance in a generation to actually do something, it's going to tell us that, you know, our government is really not capable of handling an urgent national emergency.
Well, sure. Well, we know that, right? We watched them with the banks, and effectively they empowered the banks to continue to function at the expense of the taxpayer.
Right.
Katrina. Crisis going further back, totally different kind, no response, inability to react.
Right.
Healthcare, we spend 17%, 18% of our GDP. You know the statistics.
Right.
What can the American voter do other than vote for a new president or vote for a new congressman next year? If they agree with your assessment, this is a referendum on our government's ability to do what has been asked of government. If that's not happening because special interests control the Congress, what can people do to affect that?
I think in the short term, I think there's something that people can do is that they can pressure the sitting congressman to not vote for this bill if it ends up being completely watered down and doesn't have a public option or anything.
How will they even know?
How will who know?
How will the voter know whether this is a good bill or a bad bill? In other words, there's so much propaganda around the whole conversation.
That's true.
They don't get into the three pillars of mandate, of cost control, of accessibility. None of that really gets talked about because it's all scare tactics and propaganda.
That's true. And the odd thing is that there is probably going to end up being a mandate, but it's going to be an individual mandate. In other words, everybody's going to have to buy insurance. They're going to have to go out and get one. But that's going to be the only thing with teeth in the bill in the end.
The most interesting thing that I thought that you wrote in the piece, or one of them, was the fact that all the garbage, the things that protect the drug companies, the things that protect the health insurance companies are already in the bill.
Right. And
that the good ideas, the Wyden-Bennett concepts, even some of the strong aspects of single payer and public option have been pushed outside. It's as if we're sending the crap in, hoping at the last second that the good ideas can get inside the bill.
Right. And I think most people in Washington believe that this was a handshake deal between the White House and the insurance and pharmaceutical industries from the very start. The evidence for that is that just a few weeks ago, Pharma, which represents the pharmaceutical industry, agreed to pitch in $150 million to help publicize and support this bill, which of course wouldn't happen if there was anything in the bill that was going to, adversely affect those people.
What if everybody in America for a month bought their drugs from Canada? In other words, if the American people really feel they want to see health care reform and they don't feel like they're getting that delivered to them from their government, that the government still is the agent of health insurers and drug companies, not patients, and for that matter, anybody or doctors for that matter. Right.
Yeah, I think that's the next step. I mean, right now it's shown that voting alone isn't really going to do it. The only power that people have is the vote and their own dollars. And at this point, we're going to have to start voting with our dollars in some way that forces these people to pay attention. I think that's a good idea.
All right. Listen, Matt, it's a pleasure to spend a little time with you on the television. Thank you very much for joining us. Sick and Wrong is the piece in Rolling Stone. Pick it up. Check it out online. It's a nice piece, and to say the least. It's great journalism is what it is. The American status quo, by the way, seems to be generational theft. No matter where you look, you're kind of like, oh, we'll just do this by stealing it from the children.